जदीद तिब्बी तहकीक और हक़ाइक़, लेटेस्ट रिसर्च। सिर्फ खुराक काफ़ी नहीं। जदीद तहकीक बताती है कि खून में मौजूद कोलेस्ट्रॉल का तकरीबन 75% हिस्सा जिगर खुद बनाता है और सिर्फ 25% खुराक से आता है। इसलिए मौरूसी जिनियाती कोलेस्ट्रॉल एक मोमी वैसी मात्रा है जो आपके जिगर में बनता है और जिसकी हर खुलिए सेल के मुनासिब कामकाज हार्मोन्स जैसे एस्ट्रोजन और टेस्टोस्टेरोन और वाइटमिन की तैयारी के इंतहाई जरूरी है। ताहम खून में इसकी ज्यादती दिल के दौरे और फालिश का बायस बन सकती है। जदीद तिब्बी तहकीक की रोशनी में कोलेस्ट्रॉल की मुकम्मल तफसील ये है। कोलेस्ट्रॉल की अक़साम। कोलेस्ट्रॉल खून में प्रोटीन के साथ मिलकर सफ़र करता है जिन्हें लिपोप्रोटीन्स कहा जाता है। एलडीएल लो डेंसिटी लिपोप्रोटीन खराब कोलेस्ट्रॉल। इसे खराब इसलिए कहा जाता है क्योंकि ये शरीरों की दीवारों पर जम जाता है जिससे खून की नालियां तंग और सख्त हो जाती हैं। इस हालत को एथेरोस्क्लेरोसिस कहते हैं। एचडीएल हाई डेंसिटी लिपोप्रोटीन अच्छा कोलेस्ट्रॉल। इसे अच्छा कोलेस्ट्रॉल इसलिए माना जाता है क्योंकि ये इजाफी कोलेस्ट्रॉल को खून की नालियों से निकालकर वापस जिगर तक पहुंचाता है जहां से ये जिस्म से खारिज हो जाता है। ट्राइग्लिसराइड्स ये खून में पाई जाने वाली एक और किस्म की चर्बी फैट है जो खाई जाने वाली इजाफी कैलोरी से बनती है। इसकी ज्यादा मिकदार भी दिल के अमराज का खतरा बढ़ाती है। कोलेस्ट्रॉल की मिसाली सतह। जदीद तिब्बी माहिरीन के मुताबिक खून में कोलेस्ट्रॉल की सतह मिलीग्राम पर डेसीलीटर यानी एमजी पर डीएल होनी चाहिए। एलडीएल खराब कोलेस्ट्रॉल 100 एमजी पर डीएल से कम बेहतरीन। एचडीएल अच्छा कोलेस्ट्रॉल मर्दों के लिए 40 एमजी पर डीएल या इससे ज्यादा और ख़वातीन के लिए 50 एमजी पर डीएल या इससे ज्यादा। गुड कोलेस्ट्रॉल 200 एमजी पर डीएल से कम। ट्राइग्लिसराइड्स 150 एमजी पर डीएल से कम। ब्लड प्रेशर, खून का दबाव, खून की नालियों की दीवारों पर खून के दबाव की पैमाइश। जदीद तहकीक के मुताबिक नॉर्मल ब्लड प्रेशर 120/80 मिलीमीटर पारा mmHg से कम होना चाहिए। जदीद तरीके गाइडलाइंस और तहकीक की रोशनी में ब्लड प्रेशर की अक़साम, वजूहात, अलामत और इलाज की तफसील है। ब्लड प्रेशर की दर्जाबंदी। तिब्बी तहकीक के मुताबिक ब्लड प्रेशर की 4 बुनियादी अक़साम हैं। नॉर्मल 120/80 mmHg से कम। एलिवेटेड ऊपर वाला प्रेशर 120 से 129 mmHg के दरमियान और नीचे वाला 80 mmHg से कम। स्टेज 1 हाइपरटेंशन। स्टेज 1 ऊपर वाला 130 से 139 mmHg या नीचे वाला 80 से 89 mmHg। स्टेज 2 हाइपरटेंशन। स्टेज 2 ऊपर वाला 140 mmHg या इससे ज्यादा या नीचे वाला 90 mmHg या इससे ज्यादा। हाइपरटेंशन क्राइसिस। हाइपरटेंसिव क्राइसिस ऊपर वाला 180 mmHg से ज्यादा और नीचे वाला 120 mmHg से ज्यादा। यह हंगामी तबीयत सूरत हाल है। खामोश हाल। नीति की रिपोर्ट्स के मुताबिक ज्यादा ब्लड प्रेशर को खामोश हाल कहा जाता है क्योंकि अक्सर मरीजों में इसकी कोई वाज़ेह अलामत ज़ाहिर नहीं होती लेकिन ये अंदर ही अंदर दिल, दिमाग और गुर्दों को शदीद नुकसान पहुंचा सकता है। बुनियादी वजूहात और रिस्क फैक्टर्स। जदीद तहकीक के मुताबिक ब्लड प्रेशर बढ़ने के अहम असबाब ये हैं। जिन्याती अवामिल, जेनेटिक्स, खानदानी तारीख, ग़िज़ा, नमक, सोडियम का ज़्यादा इस्तेमाल, प्रोसेस्ड फूड और चीनी वाली ग़िज़ाएं, तर्ज़ ज़िंदगी, वर्जिश की कमी, मोटापा, तंबाकू नोशी और अल्कोहल का इस्तेमाल, तनाव, स्ट्रेस, मुस्तकिल ज़हनी दबाव और नींद की कमी, उम्र और दीगर बीमारियां, उम्र बढ़ने के साथ शरीर का वसा खुलना, ज़्यादा से गुर्दों के अमराज, मुमकिन अलामत, हर चीज़ खामोशी से बढ़ता है लेकिन जल्दी सूरत में अलामत ज़ाहिर हो सकती हैं। सर्दी, सुस्त खालियत, सांस का फूलना, सीने दर्द या बेचैनी, रज़ा कदम, थकान और उलझन। जदीद साइंसी इलाज और लाइफस्टाइल। जदीद तिब्बी तहकीक जैसे अमेरिकन हार्ट एसोसिएशन की गाइडलाइंस के मुताबिक ब्लड प्रेशर को कंट्रोल करने के लिए तर्ज़ ज़िंदगी में तब्दीली सबसे बुनियादी इलाज है। 1 ग़िज़ाई तब्दीलियां, डाइटरी चेंजेस, डैश डाइट, फल, सब्जियां, कम फीकाइन वाली न्यूज़ और सारा अनाज, कोल्ड ड्रिंक्स इस्तेमाल करें। नमक की मात्रा को 1500 से 300 मिलीग्राम तक महदूद करें। 2 वर्जिश और ज़िंदगी में रोज़ाना 30 मिनट की वर्जिश जैसे इसका साइकिल और वज़न को मुताबिक रखना खून बनाता है। 3 अद्वियात, मेडिकेशन। अगर ऐसे ब्लड प्रेशर कंट्रोल ना हो तो डॉक्टर या अद्वियात तजवीज़ करते हैं। एसी इनहिबिटर्स, एआरबी, एंजियोटेंसिन रिसेप्टर ब्लॉकर्स, कैल्शियम ब्लॉकर्स, डायरेटिक्स। क्या आप अपनी एक्सरसाइज ब्लड प्रेशर के हवाले से मज़ीद रहनुमाई हासिल करना चाहते हैं? अगर आप कुछ मशवरा बताएं तो मैं आपको मज़ीद मखसूस और मशवरा फराहम कर सकती हूं। यूरिक एसिड जिसमें जल्दी तौर पर बनने वाला एक कीमिया है जो पूरी प्रोटीन के रूप में पैदा होता है। साइंसी तहकीक के मुताबिक इसकी ज्यादती जोड़ों दर्द, गाउट और गुर्दे की पथरी का बायस बन सकती है। इसकी मुकम्मल तफसील, अलामत और जदीद तिब्बी इलाज। यूरिक एसिड क्यों बढ़ता है? जब जिस्म यूरिन को हजम करता है तो यूरिक एसिड बनता है। आम हालात में ये खून के जरिए गुर्दों तक पहुंचता है और पेशाब के रास्ते खारिज हो जाता है। ताहम ब्लड वजूहात के बिना पर इसका इलाज कम हो जाता है या पैदावार बढ़ जाती है। ग़िज़ा ऐसी खुराक का ज्यादा इस्तेमाल जिनमें यूरिन ज्यादा हो जैसे सुरकुश, समुद्री ग़िज़ा और मीठे मशरूबात। जिन्याती अवामिल, खानदानी तारीख के बायस यूरिक एसिड की सतह बुलंद रह सकती है। मोटापा और मेटाबॉलिक सिंड्रोम, वज़न का ज्यादा होना गुर्दों में यूरिक एसिड खारिज करने की सलाहियत को मुतासिर करता है। दीगर तबीयी मसाइल, हाइपरपेरियालिस या गुर्दों के पानी की कमी। खून में यूरिक एसिड बढ़ जाना एक खामोश बीमारी है लेकिन जोड़ों में क्रिस्टल्स, मोनोसोडियम यूरिक क्रिस्टल्स की शक्ल जमा होना शुरू हो जाए तो ये अलामत होती है। जोड़ों में शदीद दर्द, खासतौर पर पांव के अंगूठे में, जोड़ का सूज जाना, गर्म महसूस होना और सुख हो जाना, जोड़ों की हरकत में सख्ती और तकलीफ, शदीद सूजन जोड़ों के नीचे गिरियां तो फिर बचाना। नॉर्मल सतह, साइंसी मेयार। जदीद तिब्बी लैबोरेटरीज के मुताबिक खून में यूरिक एसिड नॉर्मल सतह ये है। मर्दों में 40 से 8 मिलीग्राम फी एसिड, औरतों में 2 से 7 से 3 मिलीग्राम फी एसिड। जदीद तहकीक की रोशनी में बचाव और खुराक। मौजूदा साइंसी तहकीक के मुताबिक तर्ज़ ज़िंदगी में तब्दीली एसिड को कंट्रोल करने में 50% पैदा करती है। क्या खाएं? विटामिन सी से भरपूर फल, ताज़ी सब्जियां, कम चिकन वाली मीट मसनूआत और कॉफी। साइंसी तहकीक के मुताबिक कॉफी यूरिक एसिड कम करने में मददगार है। क्या ना खाएं? रेड मीट, बीफ, मटन, कलीजी, शराब, हाई फ्रक्टोज मिठास वाली बर्गर मशरूबात से परहेज़ करें। हाइड्रेशन दिन में कम से कम 5 से 10 गिलास पानी पिएं ताकि गुर्दे से आसानी खारिज कर सकें। इलाज अगर तर्ज़ ज़िंदगी और खुराक में तब्दीली से यूरिक एसिड कंट्रोल ना हो तो जदीद में दर्द अद्वियात का इस्तेमाल किया जाता है। एलोपीनॉल और फिक्सोस्टैट ये अद्वियात जिस्म में यूरिक एसिड बनने में कारगर हैं। प्रोटीन से ये दो यूरिक एसिड ज्यादा हजम में मदद करती हैं। ब्लड प्रेशर कंट्रोल करने के लिए डॉक्टर को जल्दी या कुछ अद्वियात तजवीज़ करते हैं। अगर आपको करीबी सस्ती शिकायत है तो मैं आपकी मदद कर सकता हूं। अगर आप बताएं कि आपने हाल ही में यूरिक एसिड टेस्ट कराया है और इससे पता है कि आपको जोड़ों में दर्द जैसी कोई अलामत महसूस हुई है, क्या आपको इसके अलावा कोई और बीमारी ज़्यादा प्रेशर है जिसकी बुनियाद पर आपको मज़ीद तफसील और बेहतर इलाज की जा सके। कमेंट सेक्शन में तफसील के साथ लिखें। ज़्यादा एक दायमी बीमारी है जिसमें खून में शुगर ग्लूकोज की सतह मामूल से ज्यादा हो जाती है। जल्दी साइंसी तहकीक के मुताबिक इस बुनियादी वजह ब्लड पैंक्रियास का मुनासिब मिकदार में इंसुलिन पैदा करना या जिस्म का इंसुलिन का मुनासिब तरीके से इस्तेमाल न करना इंसुलिन रेजिस्टेंस है। हालिया तबीयी तहकीक की रोशनी में ज़ियादतीस की मुकम्मल गाइड दर्ज है। ज़ियादतीस की अक़साम। टाइप 1 ज़ियादतीस, टाइप 1 डायबिटीज ये एक ऑटो इम्यून बीमारी है। इसमें जिस्म का मुदाफ़ियती निज़ाम ब्लड के इंसुलिन बनाने वाली बुनियाद को तबाह कर देता है। इसके शिकार अफराद को रोज़ाना इंसुलिन के इंजेक्शन की ज़रूरत होती है। टाइप 2 ज़ियादतीस, टाइप 2 डायबिटीज ये सबसे आम किस्म है जिसमें जिस्म इंसुलिन का सही इस्तेमाल नहीं कर पाता। ये तर्ज़ ज़िंदगी, मोटापे और मौरूसी अवामिल की बाइस होती है। जेस्टेशनल ज़ियादतीस, जेस्टेशनल डायबिटीज ये हमल के दौरान ख़वातीन में नमदारती और ज़्यादातर बच्चे पैदाइश के बाद खत्म कर देती है। आम अलामत अगर आपको दर्द से अलामत महसूस हो तो फौरी डॉक्टर से मिलें। बहुत ज़्यादा खांसना और बार-बार पेशाब आना, बार-बार वज़न में तेज़ी से कमी करना, हर वक्त शरीर थकन और कमज़ोरी का एहसास होना, धुंधला दिखाई देना, ज़ख्म का बहुत तेज़ से भरना, बार-बार इन्फेक्शन खुसूसन जल्द या पेशाब का होना। जदीद साइंसी तहकीक और इलाज। जदीद मेडिकल साइंस में ज़्यादती के इलाज और इंतज़ाम में इनकलाबी तब्दीलियां मुतारिफ कराई हैं। इनमें शामिल है मुसलसल ग्लूकोज मॉनिटरिंग सीजीएम और ऐसे फ्लू के सेंसर्स दस्तयाब हैं जो जिस्म में लग जाते हैं और 24 घंटे खून में शुगर की सतह स्मार्टफोन पर दिखाई देते हैं। स्मार्ट इंसुलिन पंप्स। जदीद इंसुलिन पंप्स खून में शुगर की कमी को महसूस करके दुरुस्त मिकदार में इंसुलिन जिस्म में खारिज करते हैं। नई अद्वियात तहकीक ने ऐसे अद्वियात मुतारिफ कराई हैं जो न सिर्फ शुगर को कंट्रोल करते हैं बल्कि गुर्दों और दिल की हिफाजत भी करती हैं। स्टेम सेल थेरेपी टाइप 1 ज़ियादतीस के इलाज के लिए स्टेम सेल थेरेपी चाहिए ताकि ब्लड की खराब खुलिया को दोबारा फाल किया जा सके। लाइफस्टाइल और खुराक। तो माहिर के मुताबिक तर्ज़ ज़िंदगी में तब्दीली से टाइप 2 ज़ियादतीस को कंट्रोल और रिवर्स किया जा सकता है। मुतवाज़िन ग़िज़ा। अपनी खुराक में फाइबर, सब्जियां, फल और सारे अनाज में कार्बन है और प्रोसेस्ड शुगर, सफ़ेद रोटी और मीठे मशरूबात से मुकम्मल परहेज़ करें। वर्जिश। रोज़ाना कम से कम 30 मिनट के लिए सैर करें या वर्जिश को मामूल बनाएं। ये जिस्म में इंसुलिन की हसासियत को बेहतर बनाती है। वज़न की कमी। जिस्मानी वज़न का 5 से 7% से कम करने से ज़्यादा कंट्रोल करने में ज़बरदस्त मदद मिलती है। ज़्यादतीस की पेचीदगियां। शुगर लेवल तबीयत से दिखाई देने से जिस्म के अहम अज़ा को नुकसान पहुंच सकता है जिसमें शामिल है दिल के दौरे और फालिज का खतरा, आसानी निज़ाम की खराबी, न्यूरोपैथी, गुर्दों के अमराज, नेफ्रोपैथी, बिनाई अमराज से बनना, रेटिनोपैथी। नोट: ज़्यादती एक खामोश खाती बीमारी है। इसकी तशख़ीस और इलाज के लिए हमेशा किसी मुस्तनिद डायग्नोस्टिक से मशवरा करें।
इंसानी जिस्म की बेहतरीन कारकर्दगी के लिए विटामिन्स और मिनरल्स बुनियादी जुज़ हैं। ये दो अक़साम में तक़सीम होते हैं, पानी में हल होने वाले और चर्बी में हल होने वाले। जदीद साइंसी तहकीक की रोशनी में इनकी तफसील दर्ज झैल है। 1. पानी में हल होने वाले विटामिन्स ये जिस्म में ज़ख़ीरा नहीं होते इसलिए इन्हें रोज़ाना ख़ुराक से हासिल करना ज़रूरी है। विटामिन सी मुदाफ़ियती निज़ाम को मज़बूत करता है और जिल्द के लिए कोलेजन बनाता है। हासिल करें तुर्श फल, माल्टा, लीमू, स्ट्रॉबेरी और शिमला मिर्च। बी कॉम्प्लेक्स ये 8 विटामिन्स का मजमूआ है जैसे B1, B6, B12। जो तवानाई पैदा करने और आसानी निजाम को दुरुस्त रखने में मददगार है। हासिल करें अंडे, दूध, सब्ज पत्तों वाली सब्जियां और गोश्त। 2. चर्बी में हल होने वाले विटामिन। ये विटामिन जिस्म की चर्बी में जज्ब होते हैं और जिगर में जख्रिया होते हैं। विटामिन डी हड्डियों की मजबूती और कैल्शियम जज्ब करने के लिए नागजीर है। हासिल करें रोजाना सुबह की धूप, फैटी फिश, सामन और फोर्टिफाइड दूध। विटामिन ए आंखों की बीमारी और खलियों की नशोनुमा के लिए जरूरी है। हासिल करें गाजर, शकरकंदी और पालक। विटामिन ई ये ताकतवर एंटीऑक्सीडेंट है जो खलियों को नुकसान से बचाता है। हासिल करें बादाम, सूरजमुखी के बीज और जैतून का तेल। विटामिन के खून को जमने से रोकने, जख्म पर और हड्डियों की सेहत के लिए अहम है। हासिल करें ब्रोकली और बंद गोभी। 3. अहम मिनरल्स मादनियात जिसम को सेहतमंद रखने के लिए इनकी भी बहुत जरूरत होती है। कैल्शियम हड्डियों और दांतों की मजबूती का ज़ामिन। हासिल करें दूध, दही और पनीर। आयरन खून में ऑक्सीजन की फराहमी हीमोग्लोबिन के लिए लाजमी है। हासिल करें पालक, दालें और सुर्ख गोश्त। जिंक मुदाफियती निजाम को बेहतर बनाता है और जख्म भरने में मदद करता है। हासिल करें कद्दू के बीज, गोश्त और नट्स। मैग्नीशियम पटरी सुधरने और ब्लड प्रेशर को कंट्रोल करने में माविन है। हासिल करें डार्क चॉकलेट, बादाम और एवोकाडो। मुस्तंद तिब्बी मालूमात और अपनी रोजाना की खुराक की चार्ट के लिए आलमी इदारा सेहत WHO की वेबसाइट विजिट करें। अगर आप चाहें तो मैं आपकी रहनुमाई के लिए दर्ज मालूमात फराहम कर सकता हूं। क्या आप किसी मखसूस बीमारी जैसे खून की कमी या हड्डियों के कमजोर होने के हवाले से मालूमात चाहते हैं या आप अपनी उम्र और जिन्स बताना पसंद करेंगे ताकि आपकी जरूरियात के मुताबिक ग़िज़ाई मशवरा दे सकें।
तवील अरसा तंदुरुस्त और सेहतमंद जिंदगी पाने का नुस्खा कीमिया जदीद साइंसी तहकीक की रोशनी में। तवील और सेहतमंद जिंदगी का राज जदीद साइंसी तहकीक की रोशनी में मुतवाज़िन खुराक, बाकायदा जिस्मानी वर्जिश, मियारी नींद और ज़हनी तनाव को कम करने में पोशीदा है। साइंसी माहिरीन के मुताबिक रोजमर्रा की अच्छी आदत से न सिर्फ उम्र बढ़ती है बल्कि बुढ़ापे में भी बीमारी दूर रहती है। सेहतमंद और तवील जिंदगी के लिए दर्ज झेल बातों पर अमल करना निहायत जरूरी है। मुतवाज़िन ग़िज़ा, मुतवाज़िन डाइट। अपनी खुराक में ताज़ा सब्जियां, फल, सारा अनाज, होल ग्रेन्स और प्रोटीन शामिल करें। चीनी, बाज़ारी खानों और चिकनाई का इस्तेमाल कम से कम करें। जिस्मानी सरगर्मी, एक्सरसाइज। रोजाना कम से कम 30 मिनट की वर्जिश जैसे चहलकदमी, जॉगिंग या स्विमिंग को मामूल बनाएं। ये दिल की बीमारियों और ज़्यादती के खतरे को कम करती है। मियारी नींद, गहरी नींद। रोजाना 7 से 8 घंटे की पुरसकून नींद लें। अच्छी नींद जिस्मानी खुराक की मरम्मत करती है और दिमागी सेहत को बेहतर बनाती है। ज़हनी दबाव से दूरी, ज़हनी तनाव में कमी। योगा, मुराक़बा, मेडिटेशन और गहरे सांस लेने की मशकों से ज़हनी दबाव को कंट्रोल करें। तंबाकू से परहेज। सिगरेट नोशी तक करने से फेफड़ों के कैंसर और दिल के दौरे के खतरा नुमाया तौर पर कम हो जाते हैं। बाकायदा तबीब मुआयने, स्क्रीनिंग। किसी भी बीमारी के बर वक्त इलाज के लिए अपने डॉक्टर से बाकायदा चेक करवाते रहें।
A window air conditioner running for 5 minutes and then stopping for 15 minutes is likely experiencing short cycling, often caused by dirty air filter, restricted airflow, or a faulty thermostat sensor. The unit is likely overloading and shutting down to prevent damage, failing to properly dehumidify or cool the room. Common reasons for this behavior: dirty filter airflow blockage. A clogged filter restricts airflow, causing the evaporator coils to freeze or the unit to overheat, forcing it to shut down. Dirty condenser coils. If the exterior coils are dirty, the unit cannot release heat efficiently, causing it to overheat and turn off. Misaligned thermostat sensor. The sensor may be positioned too close to the cold coils, causing it to read the air as colder than it is and shut the unit off prematurely. Oversized unit. If the AC is too powerful for the room, it cools the immediate area instantly and turns off before cooling the entire room. Low refrigerant. A refrigerant leak can cause the system to freeze up and stop cooling, resulting in short cycles. What to do? Clean or replace the air filter immediately. Clean the outdoor condenser coils to allow proper heat release. Ensure the thermostat sensor is positioned correctly, not touching the coils. If the issue persists, the compressor may be overheating, requiring professional service.
Human body respiratory system. 4. Neural control and regulation. Breathing is primarily automated by the brainstem, but can be voluntarily influenced. Medulla oblongata establishes the rhythmic pace of breathing using the dorsal respiratory group, inspiration, and ventral respiratory group, forced breathing. Pons modulates the breathing rate via the pneumotaxic center, prevents overinflation, and apneustic center, prolongs inspiration. Chemoreceptors detect changes in CO2, O2, and pH. High CO2 levels lower pH, triggering faster, deeper breathing to expel the acid-causing waste. 5. AI-driven advancements in respiratory science. AI and machine learning (ML) are transforming respiratory care through advanced automated diagnostics. MDPI. Smart inhalers utilize sensors to monitor usage technique, track adherence, and provide data to optimize treatment for asthma and COPD. Auscultation and digital stethoscopes. AI algorithms can analyze lung sounds to detect crackles and wheezes with high precision, approximately 85 to 90% accuracy, overcoming the sensitivity of traditional stethoscopes. Diagnostic imaging. Deep learning models (DL models) can quickly interpret chest CT scans and X-rays to identify nodules and lung diseases, including tuberculosis. Ventilation optimization. AI systems such as VentAI can optimize mechanical ventilation settings, positive and expiratory pressure, tidal volume in real time, reducing mortality and complications in ICU patients. Predictive analytics. ML models can forecast respiratory exacerbations like COPD days before they occur by analyzing sensor data. Organ on a chip. Microfluidic technologies are used to mimic lung function, providing a way to study disease mechanisms and test drugs at a cellular level. 6. Common respiratory disorders. Chronic obstructive pulmonary disease (COPD), long-term obstruction of airflow, pneumonia, infection of the alveoli causing fluid buildup, pneumothorax, air enters the pleural cavity causing lung collapse, apnea, cessation of breathing commonly during sleep. 7. Other functions. Beyond breathing, the system allows for vocalization, speech via vocal cord vibration in the larynx, and facilitates the sense of smell via the olfactory nerve.
A comprehensive scientific category of food sources or simple minerals is organized well based on nutritional research. A balanced diet focusing on whole foods, fruits, vegetables, lean proteins, nuts, seeds, and whole grains is the best way to obtain these micronutrients. Fat-soluble vitamins stored in the body. Vitamin A, retinol, and beta-carotene. Beef liver, eggs, fish, fortified milk, sweet potatoes, carrots, pumpkin, spinach, cantaloupe. Vitamin D, fortified milk or liver, fatty fish, salmon, sardines, egg yolks, fortified breakfast cereals, cod liver oil. Vitamin E, vegetable oils, safflower, sunflower, nuts, almonds, hazelnuts, seeds, sunflower, leafy green vegetables, spinach, broccoli. Vitamin K, kale, spinach, broccoli, collard greens, cabbage, soybean oil, canola oil. Water-soluble vitamins need regular intake. Vitamin C, citrus fruits, oranges, grapefruit, red and green peppers, kiwi, strawberries, broccoli, tomatoes. Vitamin B1, whole grains, pork, liver, legumes, beans, lentils, enriched cereals. Vitamin B2, milk, cheese, eggs, liver, enriched breads and cereals. Vitamin B3, meat, poultry, fish, whole grains, nuts, legumes. Vitamin B5, almost all animal foods, especially chicken, beef, potatoes, oats. Vitamin B6, fish, beef liver, bananas, chickpeas, potatoes, chicken. Vitamin B7, eggs, salmon, pork, sunflower seeds, sweet potatoes. Vitamin B9, folate, folic acid, dark green leafy vegetables, spinach, asparagus, oranges, legumes, beans, lentils, fortified cereals. Vitamin B12, meat, fish, poultry, eggs, milk, fortified cereals, naturally acid in plants. Major minerals, required more minerals. Calcium, milk and rice, sardines, kale, broccoli, fortified plants, milk, juice, magnesium, spinach, nuts, almonds, legumes, seeds, brown rice, whole wheat bread, potassium, bananas, potatoes, white beans, salmon, liver, leafy greens, fruit juice, sodium, table salt, sodium chloride, soy sauce, phosphate, phosphorus, red meat, beer, rice, fish, chicken, whole grains, trace minerals, required minerals, iron, red meat, poultry, beans, iron, fortified cereals, breadfruit, spinach, zinc, butchers, red meat, poultry, shellfish, legumes, nuts, iodine, high salt, seafood, seeds, beer, rice, sodium, brazil nuts, seafood, pork meats, eggs, copper, shellfish, nuts, seeds, alcohol, water, mayonnaise, nuts, legumes, whole grains, tea, cream, meat, whole grains, spices, butter, fluoride, fluoride, water, tea, fish, nutrient dense food sources, dark green leafy vegetables, spinach, kale, broccoli, vitamin K, egg, seed, folate, iron, calcium, whole meat, liver, extremely high vitamin B2, iron, nuts, seeds, almonds, brazil nuts, sunflower seeds, vitamin E, magnesium, copper, fatty fish, salmon, mackerel, sardines, vitamin D, B12, potassium, legumes, beans, lentils, chickpeas, iron, magnesium, folate.
Based on scientific research and advancements as of May 2026, the endocrine system is recognized as a complex dynamic regulatory network, increasingly managed through AI-driven precision medicine and novel hormonal therapies. It operates by releasing signaling molecules, hormones, directly into the bloodstream to coordinate blood functions, metabolism, growth, and reproduction by locking into specific target cells, core components, and glandular functions. The system comprises major glands that act as centers of homeostasis, often utilizing feedback loops to maintain balance. Hypothalamus, the master integrator linking the nervous and endocrine system, regulating the pituitary gland via neurohormones. Pituitary gland, known as the master gland, it produces hormones that regulate other endocrine glands, including growth hormone, GH, ACTH, and TSH. Thyroid gland produces triiodine and trypsin, metabolism. 2026 research emphasizes that both iodine deficiency and excess can cause dysfunction. Adrenal glands, divided into the medulla, epinephrine, norepinephrine for fight or flight, and cortex, cortisol for stress and metabolism, and aldosterone for sodium balance. Pancreas produces insulin, lowers blood sugar, and glucagon raises blood sugar. Gonads, ovaries, testes produce sex steroids, estrogen, progesterone, testosterone, regulating reproductive health. Pineal gland releases melatonin to regulate circadian rhythms. Major 2026 scientific advancements and research. Research in 2026 focuses on overcoming metabolic disorders and optimizing hormone delivery. GLP-1 receptor agonists, GLP-1 RAs, continue dominance in research, with studies expanding to show their effectiveness in reducing weight and managing type 1 diabetes, in addition to cardiovascular, adipose, and kidney benefits. Orforglipron
Foundayo, approved as the first daily oral non-peptide GLP-1 pill, which does not require strict food or water restrictions. Type 1 diabetes, T1D, breakthroughs, advances in generating insulin-producing cells from human stem cells show promise for curing T1D. The drug is about approval with expanded to children 1 year and older to delay the onset of T1D. For personalized medical advice, always consult a qualified healthcare professional. Endocrine system, part 2. Atropine protein research. Research highlights that atropine can improve reproductive function and insulin sensitivity in diabetic cases, performing better than metformin in restoring testicular health in studies. Bone/pain management. Bone-related hormone has been identified that can stop pain-sensing nerves from growing into damaged spinal areas, offering new avenues for chronic pain treatment. Oral insulin. Researchers at Kumamoto University are advancing oral insulin pill technology, which could replace daily injections for millions. Reproductive and endocrine links. Studies on GABA and kisspeptin show they play significant roles in regulating metabolic and reproductive homeostasis. AI and endocrinology, 2026 landscape. Artificial intelligence is deeply integrated into diagnosis and patient monitoring, often exceeding 99% accuracy in specific validation sets for cancer classification. Predictive diagnostics. AI algorithms are used to screen thyroid nodules, detect adrenal malignancies, and assess osteoporosis risks. Personalized treatment. Machine learning models are used for personalized diabetes care, including glycemic control prediction and closed-loop insulin delivery, artificial pancreas. Virtual care. AI enhances telemedicine by allowing remote monitoring of pathologies and risk factors. Menopause and brain health. New research connects menopause to brain matter loss in brain regions involved in memory and emotional regulation. Endocrine disruptors. Growing evidence links excessive prenatal thyroid dysfunction to increase autism risk in children. Obesity and metabolism. Evidence suggests that skipping breakfast and eating late dinners increases the risk of osteoporosis and metabolic issues. Future outlook 2026 plus. The focus is shifting towards precision, durable, disease-modifying therapies, moving beyond mere symptom management. Key research agendas include developing better, faster-acting insulin, refining long-term metabolic management through GLP-1 agonists, and understanding the genetic factors that affect hormone drug efficacy. For personalized medical advice, always consult a qualified healthcare professional. Human body respiratory system. 4. Neural control and regulation. Breathing is primarily automated by the brainstem, but can be voluntarily influenced. Medulla oblongata establishes the rhythmic pace of breathing using the dorsal respiratory group, inspiration, and ventral respiratory group, forced breathing. Pons modulates the breathing rate via the pneumotactic center, prevents overinflation, and agonistic center, prolongs inspiration. Chemoreceptors detect changes in CO2, O2, and pH. High CO2 levels lower pH, triggering faster, deeper breathing to expel the acid-causing waste. 5. AI-driven advancements in respiratory science. AI and machine learning (ML) are transforming respiratory care through advanced automated diagnostics. MPPI. Smart inhalers utilize sensors to monitor usage technique, track adherence, and provide data to optimize treatment for asthma and COPD. Auscultation and digital stethoscopes. AI algorithms can analyze lung sounds to detect crackles and wheezes with high precision, approximately 85 to 90% accuracy, overcoming the subjectivity of traditional stethoscopes. Diagnostic imaging. Deep learning models (DL models) can quickly interpret chest CT scans and X-rays to identify nodules and lung diseases, including tuberculosis. Ventilation optimization. AI systems such as VentAI can optimize mechanical ventilation settings, positive and expiratory pressure, tidal volume in real time, reducing mortality and complications in ICU patients. Predictive analytics. ML models can forecast respiratory exacerbations like COPD days before they occur by analyzing sensor data. Organ on a chip. Microfluidic technologies are used to mimic lung function, providing a way to study disease mechanisms and test drugs at a cellular level. 6. Common respiratory disorders. Chronic obstructive pulmonary disease, COPD, long-term obstruction of airflow, pneumonia, infection of the alveoli causing fluid buildup, pneumothorax, air enters the pleural cavity causing lung collapse, apnea, cessation of breathing, commonly during sleep. 7. Other functions. Beyond breathing, the system allows for vocalization, speech via vocal cord vibration in the larynx, and facilitates the sense of smell via the olfactory nerve. Human respiratory system. Description, parts, function. The human respiratory system is a complex, high-efficiency biological apparatus responsible for gas exchange, supplying oxygen, O2, to the blood, and removing carbon dioxide, CO2, waste. It operates through the interplay of anatomical structures, mechanical forces, and neural control to maintain internal homeostasis. 1. Functional anatomy and structure. The system is divided into the upper and lower respiratory tracts, designed for conducting, warming, filtering, and humidifying air. Upper respiratory tract includes nose/nasal cavity, primary air entry point, filtered by cilia and mucus, mouth, alternative air passage, and pharynx, throat. Lower respiratory tract comprises the larynx, voice box, containing the epiglottis to prevent food aspiration, trachea, windpipe, bronchi, and lungs. The tracheobronchial tree. The trachea branches into the left and right primary bronchi, which divide into secondary and tertiary bronchi, eventually branching into smaller bronchioles, forming a tree-like structure. Alveoli. The terminal end of the bronchioles. These tiny grape-like air sacs, approximately 150 million per lung, are the functional units of respiration, where gas exchange occurs. Thoracic cavity. Lungs are housed in the ribcage, separated by the mediastinum, which holds the heart. The entire thoracic cavity is enclosed by the pleurae, thin membranes that allow the lungs to move smoothly during breathing. 2. Physiology of respiration, breathing. The respiratory system acts as a gas exchange mechanism, operating via tidal breathing. Inhalation, inspiration, active process. The diaphragm, main muscle, contracts and moves downward, while intercostal muscles tighten, expanding the chest cavity and decreasing pressure, sucking air into the lungs. Exhalation, expiration, passive process, rest. The diaphragm relaxes and moves back up, shrinking chest cavity and forcing air out, powered by the natural elasticity of the lungs. Pulmonary gas exchange, external respiration, occurs at the alveoli by passive diffusion. Oxygen moves from alveoli into pulmonary capillaries, and CO2 moves from blood to alveoli. Tissue gas exchange, internal respiration, oxygen moves from capillaries into cells, and CO2 moves from cells to capillaries. 3. Key physiological mechanisms. Mucociliary escalator. The larynx, trachea, and bronchi are lined with cilia and epithelial cells and mucus, trapping dust and bacteria and moving up to the pharynx to be swallowed. Alveolar surfactant. Type 2 cells in the alveoli secrete surfactant, reducing surface tension to prevent alveolar collapse during exhalation. CO2 and pH regulation. The system acts as a buffer to maintain blood acidity by regulating CO2 removal, ensuring the body's not become too acidic. 3. Cardiac cycle and electrical system. The cardiac cycle consists of alternating contraction, systole, and relaxation, diastole. Electrical conduction system. The heart generates its own impulses, automaticity, via specialized cells. Sinoatrial node, the primary pacemaker in the right atrium that initiates the heartbeat. Atrioventricular node, delays the electrical signal to allow atria to finish emptying blood into ventricles. Bundle of His and Purkinje fibers, rapidly transmit impulses, causing ventricles to contract from the apex upward. Cardiac cycle phases. Diastole, ventricles relax and fill with blood. Systole, ventricles contract, raising pressure to eject blood into the pulmonary artery and aorta. 4. Regulation and homeostasis. Blood pressure regulation, controlled by autonomic nerve signals. Sympathetic increases heart rate, parasympathetic decreases it, and hormones. Hemostasis, platelets and fiber form clots to seal damaged vessels. Temperature regulation, blood vessel vasodilation to release heat near the skin surface, or constrict vasoconstriction to retain core heat. 5. Advanced AI in cardiovascular medicine. AI is transforming cardiology from reactive to predictive care. Diagnostics. AI algorithms analyze electrocardiograms, ECGs, and imaging MRI, CT with high accuracy, detecting conditions like arrhythmia and cardiomyopathies faster than traditional methods. Risk prediction. Machine learning models predict major adverse cardiovascular events, MACE, by analyzing vast datasets. Imaging segmentation. AI automates the quantification of myocardial strain and ventricular volume at cardiography. The cardiovascular circulatory system is a closed, high-pressure network composed of the heart, blood vessels, and blood, functioning to transport oxygen, nutrients, hormones, and waste products throughout the body. It is central to maintaining homeostasis, regulating body temperature, and providing immune protection. 1. Anatomy of the cardiovascular system. The system is divided into two primary loops, pulmonary and systemic circulation, powered by a 4-chambered muscular pump. The heart, muscular pump. Located in the thoracic cavity behind the sternum, the heart consists of 3 layers, the outer epicardium, the thick muscular middle myocardium, and the inner endocardium. Chambers. 2 superior atria, collecting chambers, and 2 inferior ventricles, pumping chambers. Septum. A muscular wall separating the left and right sides to prevent mixing of oxygenated and deoxygenated blood. Valves. 4 valves, tricuspid, pulmonary, mitral, aortic, ensure one-way flow. Blood vessels. The highway. Arteries. Thick elastic vessels that carry high-pressure blood away from the heart. Exception, pulmonary artery. Arterioles. Smaller arteries that regulate the flow and pressure into capillaries through vasoconstriction, vasodilation. Capillaries. Microscopic single-cell thick vessels where gas and nutrient exchange occurs. Veins. Lower pressure vessels with one-way valves that return blood to the heart. Blood. Transport medium. Approximately 5 liters of fluid consisting of plasma, red blood cells transporting O2, white blood cells, immunofans, and platelets, clotting. 2. Physiology and circulation pathways. The heart acts as a bubble pump that functions in 2 main loops simultaneously. Pulmonary circuit. Right side. Low pressure.
Deoxygenated blood returns from the body via superior inferior vena cava, right atrium, right ventricle, pulmonary artery, lungs, picks up O2, releases CO2, systemic circuit, left side, high pressure. Oxygenated blood returns from lungs, pulmonary veins, left atrium, left ventricle, strongest chamber, aorta, body tissues, coronary circulation, dedicated vessels, coronary arteries that supply the myocardium with oxygen, branching directly from the aorta.
Multivitamins, or MVMs, are formulated to provide a spectrum of essential vitamins and minerals, acting as nutritional insurance to fill dietary gaps. While they are not a replacement for a balanced diet, scientific research in 2025-2026 suggests potential benefits for specific populations, including cognitive support, slowing biological aging in older adults, and addressing deficiencies in pregnant women and those with restricted diets. Key scientific findings and benefits, 2025-2026 update. Recent AI-based analysis and large-scale studies have refined the understanding of multivitamin efficacy, slowing biological aging. A 2026 study published in Nature Medicine found that daily multivitamin usage among adults over 60 can modestly slow epigenetic clocks, effectively reducing biological aging by roughly 4 months over 2 years. Cognitive function preservation. Evidence from the COGS-9 trial indicates that daily MVM use improve global cognition, memory, and executive function in older adults, ages 60+, with benefits equivalent to reducing cognitive aging by approximately 2 years. Nutritional insurance and deficiency prevention. MVMs effectively increase intake of critical micronutrients like vitamin D, B12, and magnesium in individuals with poor diets. Pregnancy outcomes. MVMs containing folic acid and iron are crucial for preventing neural tube defects and lowering the risk of low birth weight and preterm births. Immune system support. Zinc, vitamin C, and vitamin D and MVMs play a key role in maintaining robust immune function, particularly in elderly populations. Limitations and nuances in research. Mortality of chronic disease. A massive 2024 analysis of 400,000 U.S. adults found that daily multivitamin use did not reduce the risk of death from heart disease, cancer, or other causes. No superpower effect. Research consistently shows that MVMs do not prevent chronic diseases in well-nourished, healthy populations. Safety hazards for smokers. High doses of beta-carotene and vitamin A and some MVMs have been linked to an increased risk of lung cancer in smokers and those exposed to asbestos. Key populations to benefit most. Scientific literature suggests targeting rather than broad supplementation. Older adults 50+, benefit from B12, calcium, and vitamin D due to reduced absorption deficiency. Pregnant or breastfeeding women requires folic acid, iron, and iodine. Individuals with restricted diets, vegans, vegetarians, or those on low-calorie diets often lack iron, B12, and zinc. People with malabsorption syndromes, including those with celiac disease or gastric bypass surgery. Recommendations for safe use. Check label. Look for products that provide nutrients close to 100% of the daily value, DV, rather than extremely high doses, as excess vitamins like vitamin A, iron, and zinc can be harmful. Third-party testing. Choose brands verified by independent organizations such as NSF International or USP to ensure quality and purity. Drug interactions. Consult a doctor, particularly taking anticoagulants, blood thinners like coumadin or diazepam, as high vitamin K can interfere with medication. Disclaimer. This information is for educational purposes only and does not constitute medical advice. Consult a healthcare provider before starting any new supplement regimen. As of May 2026, scientific research regarding multivitamin, multimineral, and VM supplements shows a shift from general one-size-fits-all recommendations towards targeted personalized supplementation, with AI playing a crucial role in predicting efficacy, optimizing bioavailability, and analyzing health outcomes. While major studies have often found minimal benefits of MVMs in reducing all-cause mortality, cardiovascular disease, or cancer, recent evidence highlights specific advantages in cognitive health, slow biological aging, and nutritional adequacy in specific populations. Key scientific findings, 2025-2026. Slowing biological aging. Data from the Cosmos clinical trial published in 2026 indicates that daily multivitamin use can slow biological aging, with participants seeing a reduction of approximately 4 months of aging over 2 years. Cognitive benefits. Research consistently suggests that daily MVM use may improve global cognition, memory, and slow cognitive aging in older adults. Pregnancy and birth outcomes. MVM supplementation in pregnant women, particularly in low-income settings, is linked to reduced risk of low birth weight and preterm births. Minimal effect on mortality. Most RCTs have found no significant benefit of general MVMs on all-cause mortality, visual acuity, or COVID-19 outcomes. AI integration and R&D. AI is currently used to analyze the efficacy of complex compounds, terpenes, peptides, fungi, and optimize nutrient density of supplements. AI-guided supplement recommendations have been shown to reduce LDL cholesterol by 25.3%, outperforming standard methods. Detailed multivitamin and mineral breakdown. 1. Essential vitamins. Vitamin D, crucial for calcium absorption and immune health. High-dose supplements can be beneficial in deficient populations, but the vital studies suggest low benefits for the general population. B vitamins, essential for energy, building metabolism, and mental fatigue reduction. B6, B9, folate, and B12, crucial for brain and muscular function. Vitamin A and beta-carotene, important for vision and immune health. Our study shows smokers should avoid beta-carotene supplements. Vitamin C, known for antioxidant properties, protecting the body against oxidative stress. 2. Essential minerals, macrominerals, and trace elements. Magnesium, essential for muscle and nerve function, often included in multivitamin supplements for overall health. Zinc, vital for wound healing and immune function, especially in combined antioxidants. Iron, necessary for oxygen transport, is particularly recommended for women with triggering potential. Calcium, critical for bone strength, often combined with vitamin D to reduce fracture risk in post-menopausal women. Selenium, plays a key role in antioxidant enzyme systems and may have potential in cancer prevention. Chromium picolinate, used for metabolic support and anti-tumor balance. Key considerations for supplementation. Bioavailability. The effectiveness of mineral depends heavily on its compound form, which focus on AI-optimized formulations. Excess intakes. High-dose long-term use of certain supplements can lead to risk, particularly if nutrient levels already meet requirements from food. Targeted use. Supplements are most beneficial for specific groups, such as those with limited dietary intake, pregnant women, or older adults. AI in future directions. 2026-2031. Personalized nutrition. AI is advancing personalized nutrition through digital assessment apps that track and analyze daily dietary patterns to inform better, more targeted nutrient recommendations. Industry trends. The global MVM market is projected to grow to $20.3 billion in 2026, driven by rising preventive health awareness and personalized AI-backed products. The nervous system is a highly specialized complex communication and control network that regulates all physiological and psychological processes. It functions by collecting sensory input, integrating this information, and initiating motor outputs to maintain homeostasis, enable consciousness, and interact with the environment. Structurally, it is divided into the central nervous system, CNS, and peripheral nervous system, PNS. Structural organization. Central nervous system, CNS, the command center comprising the brain and spinal cord, housed within the skull and the called peripheral nervous system, PNS, a network of nerves, 12 pairs of cranial nerves, 31 pairs of spinal nerves, and ganglia outside the CNS that connects the CNS to limbs, organs, and skin. 2. Cellular components. Nervous tissue consists of 2 main cell types. Neurons, functional units that receive, process, and transmit information via electrical and chemical signals. Structure, composed of soma, cell body, dendrites receive signals, and an axon carries signals away. Types, sensory neurons, ganglia, motor neurons, transmit commands, interneurons process information within the CNS, neuroglia, glial cells, supporting cells that maintain homeostasis, form myelin, and provide support and protection neurons. Astrocytes, CNS, regulate blood flow and maintain the blood-brain barrier. Oligodendrocytes, CNS, stem cells, CNS, produce myelin, and insulin sheath that increases signal speed. Microglia, CNS, act as immune effectors, scavenges. 3. Neurophysiology, how it works. Neurons communicate through electrical signal, alternating between electrical signals within the neuron, and electrical signals between neurons. Resting memory potential. A non-activated neuron has a negative additional charge, approximately negative 70 millivolts, maintained by atoms. Action potential. An electrical impulse generated in the neuron is stimulated by passive potential, approximately negative 55 millivolts. Sodium channel open causing depolarization. API become positive. Slightly connection. In myelinated neurons, the signal jumps between gaps in myelin, cognitive failure, drastically increasing speed. 6. Neurotransmitters. The junction where neuron communicate with another cell. In action potential causes release of neurotransmitters into synaptic cleft. These neurotransmitters are stimulating cells, exciting or inhibited. 4. Control classifications. Somatic nervous system, controls voluntary movements, skeletal muscles, and processes sensory input, skin muscles, and types. Autonomic nervous system, AS, controls involuntary physical functions, heart rate, digestion, blood distribution. Sympathetic division, initiates fight responses, EG increased heart rate. Parasympathetic division, manages respiratory activities, e.g. swelling heart rate, stimulating digestion. Enteric nervous system, PNS, a complex web of neurons within the vestibular tract, controlling digestion independently. 5. Predictive mechanisms. Because nervous tissue is fragile, is protected by bone structure, cell and recall. Meninges, 3. Peptide domains, neurotic, rapid, PMR, cerebrospinal fluid, CSF, cushions, brain, and spinal cord, blood-brain barrier, highly selective membrane, response substances entering the brain. 6. Common pathologies, neurodegenerative disorders, Parkinson's disease, Alzheimer's disease, multiple sclerosis, vascular accidents, stroke, infections, meningitis, functional muscular disorders, epilepsy, injuries, traumatic brain injuries, spinal cord injuries. To look after your liver. AI and medical experts recommend maintaining a healthy weight, exercising regularly to reduce liver fat, and eliminating alcohol. Key dietary changes include reducing sugar and saturated fats, while increasing fiber, green tea, and vegetables. AI tools are increasingly used for early detection of liver fibrosis and managing transplant care. Key lifestyle and dietary recommendations. Diet. Focus on whole foods, including vegetables, fruits, nuts, and healthy fats like olive oil. High fiber foods like oatmeal can help reduce inflammation. Weight and activity. Maintain a healthy weight and exercise regularly to burn triglycerides and reduce fat buildup in the liver. Alcohol and toxins. Minimize alcohol intake and limit exposure to environmental toxins, either insecticides or aerosols. Sleep. Prioritize consistent sleep to ensure the liver can process toxins and manage insulin effectively. How AI and technology support liver health. Diagnostic imaging and pathology. AI algorithms analyze CT, MRI, and digitized pathology slides to identify liver disease markers, fibrosis, tumors more precisely. Non-invasive screening tools. AI-driven tools such as LiverFast or LiverPro analyze routine blood tests to assess liver fibrosis and inflammation without biopsies. Predictive analytics. AI can analyze patient data to predict disease progression and optimize transplant waiting lists. Disclaimer. AI tools are meant to support medical professionals and do not replace professional medical advice, diagnosis, or treatment. The human body is an exceptionally organized entity consisting of 11 major organ systems that collaborate to maintain homeostasis, internal balance. These systems, ranging from the framework of the skeleton to the control of the nervous system, work together to ensure survival, respiration, nutrient absorption, and waste removal. Here is a comprehensive breakdown of the internal body systems and their functions. 1. Nervous system, control and coordination. The control hub of the body, managing voluntary and involuntary actions. Components: brain, spinal cord, nerves, sensory organs. Function: detects environmental changes, processes information, and sends electrical signals to coordinate body activities. Key action: interpretations, sight, sound, touch, and tracks immediate responses, such as reflexes. 2. Cardiovascular, circulatory system, transport. The body's transportation network, keeping cells alive through circulation. Components: heart, blood vessels, arteries, veins, capillaries, and blood. Function: pumps oxygenated blood and nutrients to tissues, and transport waste products like carbon dioxide away. Key action: regulates body temperature and pH balance. 3. Respiratory system, gas exchange. The system responsible for taking in oxygen and expelling waste gas. Components: lungs, trachea, bronchi, larynx, diaphragm. Function: facilitates gas exchange between the environment and the body, supplying and removing. Key action: maintains blood pH balance by controlling carbon dioxide levels. 5. Digestive system, nutrient absorption. Processes food into energy and absorbs nutrients into the bloodstream. Components: mouth, esophagus, stomach, liver, gallbladder, pancreas, small intestine, large intestine. Function: breaks down food mechanically and chemically into nutrients, absorbing them for growth and energy, and eliminates solid waste. 6. Musculoskeletal system, movement and structure. Often split into the skeletal and muscular systems. This provides stability and locomotion. Components: bones, muscles, cartilage, tendons, ligaments. Function: provides structure and protection for internal organs, allows movement, produces blood cells and marrow, and stores minerals. 7. Endocrine system, hormonal regulation. Controls long-term body processes with chemical messengers, hormones. Components: glands, pituitary, thyroid, adrenal, pancreas, ovaries, testes. Function: regulates metabolism, growth, development, reproduction, and stress responses. Key action: secretes hormones directly into the bloodstream. Lymphatic or immune system, defense and fluid balance. The guardian of the body, protecting against pathogens and cleaning fluids. Components: lymph nodes, vessels, spleen, thymus, bone marrow, lymphocytes. Function: defends the body against infection, removes toxins, and drains excess interstitial fluid to return it to the blood. Urinary or renal system, waste elimination, filters blood and maintains fluid balance. Components: kidneys, ureters, bladder, urethra. Function: filters waste products from the blood, regulates electrolyte balance, controls blood pressure, and produces urine. Integumentary system, protection. The body's largest organ system, acting as the first line of defense. Components: skin, hair, nails, sweat glands. Function: protects internal tissues from external injury and dehydration, helps regulate temperature, and houses sensory receptors. Reproductive system, procreation. Ensures the survival of the species by creating offspring. Components: female, uterus, ovaries, fallopian tubes, vagina. Components: male, testes, penis, prostate gland. Function: produces gametes, egg or sperm, and sex hormones, facilitates fertilization, and supports fetal development. Interdependence systems. These 11 systems do not work in isolation. For example, during exercise. Nervous system increases heart rate. Respiratory system increases breathing rate to supply oxygen. Cardiovascular system transports the oxygen faster to muscles. Muscular system produces heat, and the integumentary system produces sweat to cool the body. This seamless coordination is called homeostasis.
I. Bone structure and classification. Bones are
Living tissue composed of collagen for flexibility and calcium hydroxyapatite for hardness. Classification by shape. Long bones, longer than they are wide, act as livers, either femur, humerus. Short bones, cube-shaped, provide stability, either carpals, turples. Flat bones, thin and curved, protect organs, either ribs, skull, sternum. Irregular bones, complex shapes, either vertebrae. Sesamoid bones, embedded in tendons, either patella. Structural layers. Compact bone, cortical, dense outer shell providing strength. Spongy bone, cancellous, trabecular, honeycomb-like inner structure filled with marrow. Periosteum, a tough outer membrane covering the bone, essential for repair and nutrition. IV, bone cells and remodeling. Bones are constantly remodeling, breaking down old bone and building new bone. Osteoblasts, build new bone matrix. Osteocytes, mature bone cells that maintain structure. Osteoclasts, break down, reabsorb bone tissue. V, joints, articulations, places where bones meet, allowing for movement and stability. Synarthrosis, immovable joints, either skull sutures. Amphibiorphosis, slightly movable joints, either vertebrae. Diarthrosis, freely movable joints, either knee, elbow. These often feature synovial fluid for lubrication. 6E, clinical significance, disorders. Osteoporosis, decreased bone density leading to brittle bones. Osteogenesis imperfecta, genetic disorder causing extremely brittle bones. Fractures, breaks in bone requiring immobilization for healing. Arthritis, inflammation of joints. The human skeletal system is a dynamic, living framework composed of 206 bones in the adult body, along with cartilage, ligaments, and tendons that connect them. It is not merely a rigid structure, but a multifunctional system responsible for protection, movement, mineral storage, and blood cell production. I. Major functions of the skeletal system. The skeleton performs 6 primary functions essential for survival. Support. It provides the structural framework for the body, maintaining its shape and supporting soft tissues. Protection. Bones protect delicate internal organs. Key examples include the skull, brain, vertebrae, spinal cord, and ribs, heart, and lungs. Movement. Bones act as levers. Muscles attached to bones by tendons pull on them to produce movement. Mineral storage and homeostasis. Bones act as a reservoir for essential metals, particularly calcium and phosphorus, releasing them into the bloodstream as needed. Blood cell production. Hematopoiesis. Red bone marrow found in the spongy bone of certain bones, like the pelvis and sternum, produces red blood cells, white blood cells, and platelets. Endocrine regulation. Bone cells release a hormone called osteocalcin, which regulates blood sugar, glucose, and fat deposition. I. Divisions of the skeleton. The skeletal system is divided into 2 major parts. A. Axial skeleton, 80 bones, forms the central axis of the body and focuses on protection and support. Skull includes cranial bones protecting the brain and facial bones. Vertebral column comprised of 24 vertebrae plus the sacrum and coccyx protecting the spinal cord. Cervical 7, neck. Thoracic 12, upper back. Lumbar 5, lower back. Thoracic cage 12 pairs of ribs and the sternum, breastbone. Hyoid and ossicles. The hyoid bone in the throat and small bones in the ear. B. Appendicular skeleton 126 bones. Comprises the bones of the limbs and girdles, enabling locomotion and interaction with the environment. Pectoral girdle, clavicle, collarbone, and scapula, shoulder blade. Upper limbs, humerus, upper arm, radius ulna, forearm, carpals, wrist, metacarpals, hand, and phalanges, fingers. Pelvic girdle, hip bones, ilium, ischium, pubis. Lower limbs, femur, thigh, strongest bone, patella, kneecap, tibia, fibula, leg, tarsals, ankle, metatarsals, foot, and phalanges, toes. Fractures, breaks in bone requiring immobilization for healing. Arthritis, inflammation of joints.
IV, mechanism of muscle contraction, sliding filament theory. Muscles contract when nerve impulses trigger the shortening of sarcomeres. Stimulation, a motor neuron releases a neurotransmitter, acetylcholine, at the neuromuscular junction. Calcium release, the impulse causes the sarcoplasmic reticulum to release calcium ions. Binding, calcium binds to tropin, exposing myosin binding site on actin filaments. Power stroke, using ATP, myosin heads bind to actin, swivel, and pull the thin actin filaments towards the center of the sarcomere, shortening it. Relaxation, when the signal stops, calcium comes back into storage, myosin releases actin, and the muscle relaxes. V, major muscle groups. The muscular system is often categorized by body region: head, neck, masseter, chin, orbicular oculi, bleeding, sternocleidomastoid, neck turning, trunk, core, pectoralis major, chest, gluteus dorsi, back, rectus abdominis, abs, diaphragm, breathing, upper limbs, deltoids, shoulder, biceps brachii, front arm, triceps brachii, back arm, lower limbs, gluteus maximus, hip, quadriceps femoris, thigh, hamstrings, thigh, gastrocnemius soleus, calf. V, muscle function types: agonists versus antagonists. Skeletal muscles rarely work alone; they operate in teams. Agonist, prime mover, the primary muscle responsible for movement, e.g. biceps and curl. Antagonist, the muscle that opposes the agonist, stretching to allow movement, e.g. triceps and curl. Synergist, helps the agonist work efficiently. V, muscle types: fibers. Type 1, slow twitch, red in color, high endurance, used for long duration activities like posture. Type 2A, fast twitch, intermediate speed, moderate resistance to fatigue. Type 2B, fast twitch, white in color, very fast and powerful, but fatigues quickly, spinning. V, common muscle disorders: muscular dystrophy, genetic diseases causing progressive weakness, muscle strains, hairs and muscle fibers, whole muscle, myasthenia gravis, chronic autoimmune disorder, impairing neurons, functions, fibromyalgia, chronic pain in muscles and soft tissues. I, maintaining a healthy muscular system. Regular exercise, strength training, isotonic, isometric, improves muscle mass, while aerobic exercise increases stamina. Nutrition, adequate protein intake is vital for muscle repair and growth. Hydration, water is necessary for contraction and preventing cramps. Rest, allows muscle fibers to repair after exertion. Recovery. Pesticides for fruit and vegetables. To remove pesticides from fruit, wash produce under cold running water while scrubbing with a soft brush, or soak in a baking soda solution 1 teaspoon per 2 cups of water for 12 to 15 minutes. Peeling, removing powdered leaves, and buying organic, e.g. from the EWG's Shopper's Guide, also significantly reduce exposure.
Most effective cleaning methods. Baking soda soap, most effective. Mix 1 teaspoon of baking soda for every 2 cups or 2 teaspoons per quart of cold water. Soak fruits for 12 to 15 minutes, then rinse thoroughly. Vinegar wash. Mix 1 part white vinegar with 3 parts water and soak produce for 5 to 15 minutes. This can remove 40 to 90% of pesticide residues, though it may change the taste of delicate berries. Running water and scrubbing. Scrub firmer produce, apples, pears, cucumbers with a soft brush under cold running water for at least 30 seconds. Salt water wash. A 2% salt solution, 1 teaspoon salt in 1 cup water, can remove most contact pesticides. How to remove pesticides from produce. Berries and soft fruits. Use the baking soda soap weekly and rinse thoroughly, as they can absorb vinegar. Leafy greens. Remove outer leaves, soak in water for a few minutes, then rinse well. Wax fruits, apples and peaches. Scrub firmly, as pesticides can stick to the wax. Peeling. For items like cucumbers or apples, peeling removes surface pesticides, though it also removes some nutrients. Key considerations. Water only. Simply rinsing under running water removes dirt and some pesticides, but is less effective than soaking with baking soda. Storage. Wash fruit just before eating, not before storing to prevent mold growth. Limitations. While these methods remove surface residue, they may not eliminate systemic pesticides that have absorbed into the fruit itself.
The human muscular system is a complex, specialized organ system consisting of over 600 named skeletal muscles, along with smooth and cardiac muscles, collectively making up roughly 40-50% of an adult's body weight. Its primary purpose is to produce movement, maintain posture, circulate blood, and generate body heat. I1. Types of muscle tissue. The human body contains 3 distinct types of muscle tissue, classified by their structure, function, and control mechanism. Skeletal muscle. Attached to bones by tendons, these muscles are under voluntary control, somatic nervous system. They appear striped or striated under a microscope due to organized sarcomeres. They enable locomotion, facial expression, and posture. Smooth visceral muscle. Located in the walls of hollow internal organs, stomach, intestines, blood vessels. They are involuntary, non-striated, and controlled by the autonomic nervous system. They are responsible for processes like peristalsis, moving food, and regulating blood pressure. Cardiac muscle. Found only in the heart, myocardium. It is striated like skeletal muscle, but functions involuntarily. Cardiac cells are branched and connected by intercalated discs, allowing them to contract synchronously to pump blood. I2. Core functions of the muscular system. The muscular system serves several essential roles, far exceeding mere movement, mobility. Skeletal muscles contract to move bones. Posture and stability. Muscles continuously adjust to hold the body upright or in specific positions. Circulation. The heart pumps blood, while smooth muscles in veins and arteries help regulate blood flow. Respiration. The diaphragm and intercostal muscles contract to allow breathing. Digestion. Smooth muscles move food through the GI tract via peristalsis. Heat production. Thermoregulation. Muscular contraction generates 85% of body heat, particularly via shivering when cold. I3. Anatomy and microstructure of muscles. Muscle fiber. Cell. A single muscle cell bundled together with thousands of others to form a muscle. Fascicle. A bundle of muscle fibers wrapped in a sheath called perimysium. Myofibers. Thread-like structures within muscle fibers contain protein filaments, actin, and myosin. Sarcomere. The fundamental repeating contractile unit of striated muscle located between 2 Z discs. Connective tissue. Apicium surrounds the entire muscle. Perimysium surrounds fascicles. Endomysium surrounds individual fibers. Tendons. Dense, strong connective tissue that attaches skeletal muscle to bone. Looking after your pancreas involves maintaining a healthy lifestyle, with AI and digital health tools increasingly acting as aids for early detection and lifestyle management. The pancreas is crucial for digestion and regulating blood sugar, making its health vital for preventing conditions like diabetes and pancreatitis. Here are the best ways to care for your pancreas, informed by medical recommendations and enhanced by technological advancements. 1. Diet and nutrition. Emphasize low-fat foods. Limit fat intake to reduce the workload on your pancreas. Focus on plant-based foods, cruciferous vegetables, broccoli, cauliflower, whole grains, and lean proteins. Avoid high-fat and sugary foods. Minimize processed foods, sugary drinks, and refined carbohydrates, which can increase the risk of pancreatic inflammation, pancreatitis. Small, frequent meals. Instead of 3 large meals, eat 4 to 6 small, balanced meals to prevent overloading the pancreas. Stay hydrated. Drink plenty of water, around 6 to 8 cups daily, to prevent pancreatic flares and support enzyme production. 2. Lifestyle modifications. Stop smoking. Smoking is a significant risk factor for pancreatic cancer, with smokers being 2 to 3 times more likely to develop it. Limit or avoid alcohol. Heavy alcohol consumption is a primary cause of pancreatitis. Avoiding it entirely is recommended for those with pancreatic issues. Exercise regularly. Aim for 150 minutes of moderate exercise weekly, for example, fast walking, cycling, to maintain a healthy weight and improve insulin sensitivity. Manage stress. Chronic stress releases cortisol and can increase the risk of pancreatitis. Techniques like yoga, meditation, and deep breathing are recommended. 3. Leveraging technology and AI. Early detection and screening. AI algorithms are being developed to detect pancreatic cancer, sometimes up to a year before symptoms appear, by analyzing CT scans for subtle signs radiologists might miss. Wearable health tech. Smartwatches and apps can help track physical activity, heart rate, and overall health to manage weight and stress. AI for recurrence prediction. In case of pancreatitis, AI can analyze patient data and imaging to predict the likelihood of recurrence and assist in personalized monitoring. Self-monitoring apps. Use apps to monitor dietary intake and ensure a low-fat diet, which is critical for those recovering from acute pancreatitis. 4. When to see a doctor. If you experience symptoms like persistent upper abdominal pain, unexplained weight loss, or yellowing skin, jaundice, seek medical advice, as these could be early signs of pancreatic issues. This information is for educational purposes based on current research results and should not replace professional medical advice. Always consult a healthcare provider for any health concerns. Vitamin K and warfarin interact directly, and vitamin K promotes blood clotting, while warfarin, a blood thinner, works by inhibiting it. To maintain a safe international normalized ratio, INR, patients must keep their daily vitamin K intake consistent, rather than avoiding it entirely. A sudden increase in vitamin K lowers INR, increases clot risk, while a decrease raises INR, increases bleeding risk. The mechanism: vitamin K versus warfarin. Vitamin K function, essential for the activation of clotting factors 2, 7, 9, 10 in the liver, which allows blood to clot. Warfarin function, acts as a vitamin K antagonist, VKA. It inhibits the enzyme VKORC1, preventing the regeneration of active vitamin K and reducing blood clotting ability. Interaction: large amounts of vitamin K can overcome the inhibition caused by warfarin, making medication less effective. Managing vitamin K intake. Dietary advice. The goal is consistency, not elimination. A steady, stable intake of vitamin K enables a stable INR. High vitamin K foods. Keep consistent. Kale, spinach, collard greens, turnip greens, Brussels sprouts, broccoli, and Swiss chard. Low vitamin K foods. Safe to eat regularly. Roots, bulbs, tubers, potatoes, carrots, many fruits, bananas, cucumbers, and white mushrooms. Consistency is key. If you eat a salad every day, continue to do so. Do not suddenly stop or start eating large amounts of green vegetables. Monitoring your INR. INR, international normalized ratio. A laboratory test that measures how long it takes your blood to clot. Target range: generally 2.0 to 3.0 for most conditions, e.g. atrial fibrillation. Low INR, risk of clotting, usually caused by high vitamin K intake, making the drug less effective. High INR, risk of bleeding, usually caused by low vitamin K intake, making the drug too effective. Key tips for patients: consult a doctor before diet changes. Any major change in diet, e.g. keto, vegan, or weight loss, requires close monitoring. Multivitamins. Check your multivitamin contains vitamin K. If you take one, take it daily to maintain consistency. Inform all providers. Ensure every doctor knows your warfarin before they prescribe medications or suggest diet changes. Disclaimer: this information is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider for management of warfarin diet. A healthy diet is foundational to overall well-being, influencing immunity, energy levels, and mood. Achieving optimal gut health requires a holistic approach, combining high fiber, nutrient dense diet, consistent hydration, stress management, and regular movement. 1. Diet and nutrition for good health. Prioritize fiber. Consume 25 to 35 grams of fiber daily to aid digestion, prevent constipation, and feed beneficial bacteria. Soluble fiber. Dissolves more, helps lower cholesterol and glucose levels. Sources include oats, barley, beans, apples, and citrus fruits. Insoluble fiber. Adds bulk to stool, helping move food through the digestive tract. Sources include whole grains, wheat bran, and vegetables. Increase plant diversity. Aim for 30 different plant-based foods per week to maximize microbial diversity. Aim for probiotics, good bacteria. Eat fermented foods daily to increase beneficial bacteria that fight bad bacteria. Examples include yogurt with black cultures, kefir, sauerkraut, kimchi, miso, and kombucha. Consume prebiotic foods for good bacteria. Prebiotics are indigestible fibers that act as fuel probiotics. Examples include garlic, onions, leeks, asparagus, bananas, and oats. Add healthy fats. Incorporate omega-3 fatty acids to reduce inflammation. Examples include fatty fish, salmon, sardines, chia seeds, flax seeds, and walnuts. Reduce irritants. Limit intake of processed foods, artificial sweeteners, refined sugars, increase foods. 2. Lifestyle habits to support digestion. Hydrate. Limit fluids, water test. So allow nutrients to be absorbed and prevent constipation. Tip. Sip water between meals and consider warm water in the morning to stimulate bowels. Practice bloating. Chew thoroughly and eat slowly to reduce blood flow. Manage stress. The gut brain axis is high stress elicitation and increases inflammation. Practice yoga, deep breathing, meditation, regular exercise. Exercise increases blood flow to the digestive tract and stimulates intestinal contractions. Prioritize sleep. Aim to spend 9 hours of quality sleep daily to avoid gut repair. Avoid smoking and alcohol. Smoking doubles the risk of reflux, while alcohol increases stomach acidity and disrupts gut microbiome. 3. Keep foods to include versus avoid. Food group. Foods to focus on gut friendly. Foods to limit the vitamins, fiber flashcards, whole grains, oats, brown rice, quinoa, white bread, white pasta, pastries, vegetables, leafy greens, spinach, kale, broccoli, carrots, raw onions, garlic, sensitive, fruits, berries, citrus fruits, bananas, low fructose, high fiber fruits, sensitive, protein, lean protein, fish, poultry, legumes, tofu, red meat, processed meats, sausage, bacon, drugs, water, herbal teas, ginger, peppermint, alcohol, carbonated drinks, excess coffee. 4. When to see a doctor. Do not ignore visits and advanced issues, as they may indicate conditions like irritable bowel syndrome, gastric esophageal reflux disease, or inflammatory bowel disease. Seek professional guidance for limited temperature health, limited temperature health, persistent bloating, gas, or heartburn, frequent long-lasting constipation or diarrhea, unsustainable loss of blood and stool, chronic abdominal pain. Note: if you have specific health condition, it's always to seek a healthcare provider before you engage in a healthy diet system is foundational to overall well-being, stable immunity, energy levels, and mood. Achieving optimal gut health requires a holistic approach, combining high fiber, nutrient dense diet, consistent hydration, stress management, and regular movement. 1. Diet and nutrition for good health. Prioritize fiber. Consume 25 to 35 grams of fiber daily to aid digestion, prevent constipation, and feed beneficial bacteria. Soluble fiber dissolves in water, helping to lower cholesterol and glucose levels. Sources include oats, barley, beans, apples, and citrus fruits. Insoluble fiber adds bulk to stool, helping move food through the digestive tract. Sources include whole grains, wheat bran, and vegetables. Increase plant diversity. Include 30 different plant-based foods per week to maximize microbial diversity. Include probiotics, good bacteria. Eat fermented foods daily to increase beneficial bacteria and fight bacteria. Examples include yogurt, live cultures, kefir, sauerkraut, kimchi, miso, and kombucha. Consume prebiotic foods, food for bacteria. Prebiotics are indigestional fibers that have superior probiotics. Examples include garlic, onions, leeks, asparagus, bananas, and oats. Add healthy fats. Incorporate omega-3 fatty acids to reduce inflammation. Examples include fatty fish, salmon, sardines, chia seeds, flax seeds, and walnuts. Reduce irritants. Limit intake of processed foods, artificial sweeteners, refined sugars, reduce foods. 2. Lifestyle habits to support digestion. Stay hydrated. Drink plenty of fluids. Water is best. Allow nutrients to use to prevent constipation. Sip water between meals and consider warm water and to stimulate bowels. Practice mindful eating. Chew food thoroughly and eat slowly to reduce workload ownership. Manage stress. The gut brain axis needs high stress, low digestion, and increases inflammation. Practice yoga, deep breathing, meditation, regular exercise. Exercise increases blood flow to the digestive tract and stimulates intestinal contractions. Prioritize sleep. In presenting hours of quality sleep, make to level air. Avoid smoking and alcohol. Smoking fluids acid reflux, while alcohol increases stomach acid and stress microbiome. 3. Keep foods to glucose avoid. Food group. Foods to focus on. Fat friendly. Foods to limit. Vitamins. Fibers/carbs. Whole grains. Oats, brown rice, quinoa, white bread, white pasta, pastries, vegetables, leafy greens, spinach, kale, broccoli, carrots, raw onions, garlic, sensitive. Fruits, berries, citrus fruits, bananas, low fructose, high fructose, fruits, sensitive. Protein, lean protein, fish, poultry, lipids, tofu, red meat, processed meats, sausage, bacon, drinks, water, herbal teas, ginger, peppermint, alcohol, carbonated drinks, excessive coffee. 4. When to see a doctor. Do not ignore persistent digestive issues as they may indicate conditions like irritable bowel syndrome, gastric esophageal toxicities, or inflammatory bowel disease. Superficial minus 4. When to start your digestive health. When to start your digestive health. Persistent bloating, gas, heartburn, frequent vomiting, constipation, diarrhea, unexplained blood stool, chronic abdominal pain. Note: if you have specific existing health condition, it is always best to consult a health provider before making any dietary changes, including supplements.
How to look after your kidneys. To take care of your kidneys, maintain a healthy lifestyle
By staying hydrated, exercising regularly, limiting salt intake, managing blood pressure and blood sugar, and avoiding smoking and unnecessary anti-pain medications. Key practices also include eating a balanced diet, limiting alcohol, and getting regular kidney function screenings. Key tips for kidney health: stay hydrated, drink enough water consistently to help kidneys remove waste, but avoid excessive water intake, focusing on being water-wise. Manage blood sugar and pressure. High blood sugar, diabetes, and high blood pressure are the leading causes of kidney disease. Reduce salt intake. Consume less than 2,300 milligrams of sodium daily to help control blood pressure. Eat a healthy diet. Focus on whole grains, fruits, vegetables, and lean proteins, and avoid processed foods that are often high in sodium and phosphorus. Exercise and weight control. Maintain a healthy weight to prevent diabetes and heart disease, which can lead to kidney issues. Limit medications. Avoid overusing common over-the-counter anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, which can cause kidney damage if taken regularly. Quit smoking. Smoking reduces blood flow to kidneys, which can impair their ability to function. Synonyms and related terms: kidney health preservation, renal care, renal protection, kidney maintenance, kidney wellness. When to seek care. Kidney disease often has no early symptoms. It is essential to get tested for kidney function. Let an immune test if you have high blood pressure or diabetes. There are 13 essential vitamins and numerous vital minerals required for health. They're categorized into fat-soluble vitamins A, D, E, K, water-soluble vitamins C, and the 8 B vitamins, and minerals, macro and trace elements. These nutrients, essential for functions like immune support, bone health, and energy metabolism, must be obtained through a balanced diet or supplements. Essential vitamins: vitamin A, retinol, beta-carotene, essential for vision, skin health, and immune function. Vitamin C, ascorbic acid, antioxidant, essential for collagen production, wound healing, and immune system strength. Vitamin D, cholecalciferol, vital for calcium absorption, bone health, and immune function, produced via sunlight exposure. Vitamin E, tocopherol, antioxidant that protects cells from free radical damage. Vitamin K, 5-quinone, metaquinone, essential for blood clotting and bone health. Vitamin B1, thiamine, metabolizes food into energy and supports nerve function. Vitamin B2, riboflavin, necessary for energy production and cellular metabolism. Vitamin B3, niacin, supports nervous system, heart health, and energy metabolism. Vitamin B5, pantothenic acid, crucial for fatty acid synthesis and energy metabolism. Vitamin B6, pyridoxine, crucial for protein metabolism, red blood cell formation, and cognitive function. Vitamin B7, biotin, essential for energy metabolism and healthy hair and nails. Vitamin B9, folate, folic acid, crucial for DNA synthesis and cell replication. Vitamin B12, cobalamin, necessary for red blood cell formation and neurological function. Key minerals: calcium, major component of bones and teeth, required for muscle contraction and blood clotting. Iron, component of hemoglobin that transports oxygen in the blood. Magnesium, involved in over 300 metabolic reactions, including heart and nerve function. Potassium, regulates blood pressure, fluid balance, and muscle contractions. Sodium, essential for nerve function and fluid balance. Zinc, supports immune function, wound healing, and DNA synthesis. Iodine, essential for thyroid function and metabolic regulation. Chromium, assists with blood sugar regulation. Manganese, supports bone health and metabolism. Phosphorus, involved in energy production and bone structure. There are 13 essential vitamins needed for healthy body function, classified into two main groups: fat-soluble A, D, E, K, which are stored in the body, and water-soluble C and all B vitamins, which are not stored and require regular consumption. These nutrients are vital for metabolism, immune function, and nutrient absorption. Fat-soluble vitamins, stored in liver and fat tissue. Vitamin A, crucial for vision, immune system health, and skin health. Vitamin D, promotes calcium absorption for bone health and immune function, known as the sunshine vitamin. It includes D2 and D3 types. Vitamin E, acts as an antioxidant, protecting cells from damage. Vitamin K, essential for blood clotting and bone health. Water-soluble vitamins, not stored, need daily intake. Vitamin C, ascorbic acid, acts as an antioxidant, supports immune function, and promotes collagen synthesis. B vitamins, complex, crucial for energy production and metabolism. B1, thiamine, helps convert nutrients into energy. B2, riboflavin, essential for energy production and cell function. B3, niacin, supports energy metabolism. B5, pantothenic acid, involved in fatty acid synthesis. B6, pyridoxine, vital for amino acid metabolism and red blood cell production. B7, biotin, involved in metabolism of proteins and carbohydrates. B9, folate or folic acid, crucial for DNA synthesis and cell division. B12, cyanocobalamin, crucial for nervous system function and red blood cell formation. Key differences: storage: fat-soluble vitamins are stored in the liver and fatty tissues. Water-soluble vitamins are generally not stored, and excess is excreted via urine, with the exception of B12. Toxicity: fat-soluble vitamins can reach toxic levels if consumed in excessive amounts, while water-soluble vitamins are less likely to be toxic. Common food sources: fat-soluble, leafy green vegetables, vegetable oils, nuts, eggs, fatty fish, and fortified dairy. Water-soluble: citrus fruits, broccoli, potatoes, fortified grains, dairy, meat, and legumes.
Vitamin K is a group of
Soluble
fat-soluble
vitamins essential for blood clotting, coagulation, bone metabolism, and regulating calcium levels in the body. It acts as a necessary cofactor for enzymes that activate specific proteins, known as law proteins, which enable calcium bindings. Key forms of vitamin K: vitamin K1, phytoquinone, primarily found in green leafy vegetables, plant source, is the main dietary form, comprising 75 to 90% of total vitamin K intake. Vitamin K2, metaquinone, synthesized by bacteria, primarily found in fermented products, animal waste foods, and gut flora. It includes subtypes like MK4 and MK7, with MK7 offering superior bioactivity and longer half-life in the body. Vitamin K3, metadione, a synthetic form. It is generally not used for human consumption due to potential toxicity. Primary physiological functions: blood coagulation, clotting. Vitamin K is necessary for the liver to produce four essential blood clotting factors: II, growth 7, 9, and 10. Bone health: it activates osteocalcin, a protein that binds calcium to the bone matrix, supporting bone mineral and strength. Muscle health: exfoliation inhibition. Vitamin K activates matrix block protein, MGT, which prevents soft tissue calcification, inhibiting the hardening of blood vessels and reducing cardiovascular risk. Food sources: leafy greens, kale, spinach, broccoli, Brussels sprouts, cabbage, lettuce, Swiss chard. Fermented foods: natto, high SK2 content, cheese, animal products, meat, dairy, and egg yolks. Vegetable oils: soybean, canola, and olive oil. Daily recommendations: adequate intake. AI. The recommended daily intake of vitamin K, mainly based on vitamin K1, is adult men 19 plus 120 micrograms per day, adult women 19 plus 90 micrograms per day. Newborns: prophylactic injection of 0.5 to 1 micrograms of K1 is routinely given to prevent vitamin K deficiency bleeding, VKDB. Deficiency and symptoms: vitamin K deficiency is rare in healthy adults, but can occur due to malabsorption disorders, e.g. cystic fibrosis, celiac disease, or long-term antibiotic use. Symptoms: easy bruising, excessive bleeding, hemorrhaging, bleeding gums, and nosebleeds. Consequences: increased risk of phosphorus fractures and cardiovascular disease. Drug interactions: warfarin, codeine. Vitamin K antagonists like warfarin reduce prevent blood clots. People on warfarin must maintain a consistent stable intake of vitamin K, as vitamin K contributes to growth effectiveness. Antibiotics: long-term use can kill intestinal bacteria that produce vitamin K2. All this weight loss can reduce the absorption of fat-soluble vitamins, including K. Toxicity: there is no established tolerable upper intake level for vitamin K, as there is low potential for toxicity from food or supplements, though high doses can affect blood thinning reactions. Vitamin D is a unique fat-soluble nutrient that acts more like a steroid hormone than a traditional vitamin. It is essential to maintain calcium and phosphate levels to keep bones, teeth, and muscles healthy. Sources of vitamin D: your body can obtain vitamin D through three primary avenues. Sunlight, often called the sunshine vitamin. Your skin synthesizes vitamin D3 cholecalciferol when exposed to ultraviolet E UVB radiation. Diet: natural food sources are limited, but include fatty fish, salmon, mackerel, fish oil oils, and egg yolks. Some foods like milk and cereals are often fortified with it. Supplements: available as vitamin D2 or cholecalciferol from plants, or vitamin D3 cholecalciferol typically from animal sources, with D3 generally being more effective at various levels. Biological activation process: vitamin D from cell food is inert and must go through a two-step activation process in the body. Liver is converted into 25-hydroxy vitamin D, 1,5-OAD, also known known as calcium. This is a form of measured blood test to check your status. Kidneys is further converted into 1.5 dihydroxyvitamin D, 1.5-OH2D, or calcitriol, which is the physiologically active hormonal form. Key functions and benefits. Active vitamin D binds through receptors found in nearly every tissue in the body, influencing over 1,000 to 2,000 genes. Bone health. It stimulates the absorption of calcium and phosphorus from the gut, preventing conditions like rickets in children and osteomalacia, bone pain, or osteoporosis in adults. Immune support. It acts as an immune modulator, enhancing immunity while regulating adaptive responses to random activity. Cell growth. It helps regulate cell differentiation and proliferation, which may play a role in reducing the risk of certain cancers. Movement metabolism. Research suggests links to regulation, insulin secretion, and cardiovascular health. Efficiency and recommendations. Low levels are often caused by limited sun exposure. Certain medical conditions like CMO or kidney disease or obesity. Optimal levels. Most organizations consider levels above 30 milligrams per ml as optimal. Daily intake. The National Institute of Health (NIH) recommends an adequate intake of 400 IU for infants, and recommended dietary allowance are RDA and 600 to 800 IU for most adults. National Institute of Health. AI and machine learning in vitamin D research. Modern AI is now used to predict efficiency. Machine learning algorithms like XGBoost or random forest analyze lifestyle, demographic, and clinical factors to identify individuals at high risk of infancy without immediate blood tests. Analyze health trends. AI models process massive data sets from trials like Vital to better understand how vitamin D levels correlate with chronic diseases. Would you like to specific recommendations based on age or more about how to optimize absorption?
Vitamin C, L-ascorbic acid,
Is an essential water-soluble micronutrient and potent antioxidant crucial for immune function, collagen synthesis, and iron absorption. Adults generally require 100 to 200 milligrams per day to maintain health, with higher needs during pregnancy. It prevents scurvy and supports tissue repair, skin health, and protects cells from oxidative damage. Key aspects of vitamin C. Essential function. Because humans can't produce vitamin C internally, it must be consumed daily through diet, as it is not stored in the body. Immune support. It acts as an immune hero by stimulating antibody production, specifically natural killer cells, which enhances the body's defense against pathogens. Collagen and tissue repair. Crucial for producing collagen, making it vital for skin health, wound healing, and maintaining blood vessel integrity. Antioxidant power. Protects cells from free radical damage, which can help lower the risk of chronic diseases. Iron absorption. It enhances the absorption of non-heme iron from plant-based foods, which is essential for preventing iron deficiency anemia. Dietary resources. Vitamin C is found in many fruits and vegetables, particularly fruits, citrus fruits, oranges, lemons, kiwi, strawberries, and papaya. Vegetables, red peppers, broccoli, Brussels sprouts, kale, and sweet potatoes. Deficiency and toxicity. Deficiency. Lack of vitamin C leads to scurvy, characterized by bleeding gums, easy bruising, rough skin, hair loss, joint pain, and slow wound healing. Toxicity. While excess vitamin C is excluded, high doses, generally over 2,000 milligrams per day, UL, can cause digestive disorders such as nausea and diarrhea. Common misconceptions. Colds. While vitamin C helps the whole immune system, it does not necessarily prevent the common cold, but it may reduce the severity or duration of symptoms. Skincare. Topical vitamin C is widely recommended for whitening and anti-aging properties, often utilized to reduce dark spots and protect against UV damage. Dosage recommendations. Adults. The recommended dietary allowance for adults is around 90 milligrams for men and 75 milligrams for women per day. Optimal health. Many experts suggest daily intake of 200 to 500 milligrams for optimal antioxidant benefits. Disclaimer. This information is for educational purposes only. Always consult a healthcare professional before starting high dose supplements, particularly if you have underlying health conditions or obtain medications for chemotherapy. Essential vegan-friendly B vitamins, B1, B3, B5, B7, B9, B12 are obtained through whole foods and fortified products. Key sources include nutritional yeast, fortified cereals, milks, legumes, lentils, chickpeas, nut seeds, sunflower almonds, whole grains, quinoa, brown rice, leafy greens, and avocados. Vegan B vitamin sources. B1, thiamine, nutritional yeast, yeast extract, sunflower seeds, tahini, whole grains. B2, riboflavin, nutritional yeast, almonds, quinoa, mushrooms, fortified cereals. B3, niacin, nutritional yeast, peanuts, brown rice, whole wheat spaghetti, avocado. B5, pantothenic acid, mushrooms, avocado, potatoes, broccoli, whole grains. B6, pyridoxine, chickpeas, potatoes, bananas, nutritional yeast, walnuts. B7, biotin, nuts, almonds, walnuts, sunflower seeds, sweet potatoes, broccoli. B9, folic acid, dark leafy greens, spinach, lentils, oranges, asparagus, beets. B12, cobalamin, crucial for vegans to use fortified foods, fortified nutritional yeast, fortified plant milks, soya, coconut, fortified breakfast cereals, and tempeh. Key takeaways. Nutritional yeast is a versatile powerhouse, often providing B1, B3, and B12. Fortified foods are the most reliable source of B12, which is otherwise scarce in a vegan diet. Legumes and nuts provide a steady supply of B1, B3, B7, and B9. If you'd like to dive deeper, I can help you identify specific, easy meal plans to hit all 8 B vitamins, suggest the best supplement options for B12, just in case. Compare fortified foods to see which ones offer the most bang for your buck. Let me know if you'd like me to narrow down the best, most nutrient-dense options for your routine. B vitamins, benefits, and the best vegan sources. Food Revolution Network. August 26, 2021. More specifically, below are some of the best places to find each of the 8 complex vitamins from plant-based foods. Vitamin B1, beans, peas, lentils, and stuff. Essential vegan-friendly B vitamins, B1, B3, B5, B7, B9, B12 are obtained through whole foods and fortified products. Key sources include nutritional yeast, fortified cereals, milks, legumes, lentils, chickpeas, nut seeds, sunflower almonds, whole grains, quinoa, brown rice, leafy greens, and avocados. Vegan B vitamin sources. B1, thiamine, nutritional yeast, yeast extract, sunflower seeds, tahini, whole grains. B2, riboflavin, nutritional yeast, almonds, quinoa, mushrooms, fortified cereals. B3, niacin, nutritional yeast, peanuts, brown rice, whole wheat spaghetti, avocado. B5, pantothenic acid, mushrooms, avocado, potatoes, broccoli, whole grains. B6, pyridoxine, chickpeas, potatoes, bananas, nutritional yeast, walnuts. B7, biotin, nuts, almonds, walnuts, sunflower seeds, sweet potatoes, broccoli. B9, folic acid, dark leafy greens, spinach, lentils, oranges, asparagus, beets. B12, cobalamin, crucial for vegans to use fortified foods, fortified nutritional yeast, fortified plant milks, soya, coconut, fortified breakfast cereals, and tempeh. Key takeaways. Nutritional yeast is a versatile powerhouse, often providing B1, B3, and B12. Fortified foods are the most reliable source of B12, which is otherwise scarce in a vegan diet. Legumes and nuts provide a steady supply of B1, B3, B7, and B9. If you'd like to dive deeper, I can help you identify specific, easy meal plans to hit all 8 B vitamins, suggest the best supplement options for B12, just in case. Compare fortified foods to see which ones offer the most bang for your buck. Let me know if you'd like me to narrow down the best, most nutrient-dense options for your routine. B vitamins, benefits, and the best vegan sources. Food Revolution Network. August 26, 2021. More specifically, below are some of the best places to find each of the 8 complex vitamins from plant-based foods. Vitamin B1, beans, peas, lentils, and stuff. मुस्तंसिल पैदा आदात को अपनाकर एक तवील सेहतमंद जिंदगी बेहतरीन तरीके से हासिल की जा सकती है। बीमारी से भरपूर ग़िज़ा खाना, बाकायदगी से वर्जिश करना, 150 मिनट से ज़्यादा हफ्ता, सेहतमंद वज़न बरकरार रखना, सिर्फ मुश्किल से जनाब, शराब से परहेज़, 7 घंटे की नींद लेना और मजबूत समाजी रवायत की कायम करना और इसकी परवरिश करना। ये आदत मुमकिन तौर पर मरहूम में 1 दफ़े से ज़्यादा का इजाफ़ा कर सकती हैं। लंबी उम्र के लिए तलीमी उसूल, ग़िज़ाई आदत, सब्ज़ियाँ, फल, बगैर चना अनाज, घी, दाल, नीली और सेहतमंद चिकनाई जैसे ढीले की खुराक, वाली ग़िज़ा का इस्तेमाल करें, मिल्की प्रोसेस्ड फूड्स, सूख गोश्त और मीठे मशरूबात को कम से कम करें। जिस्मानी सरगर्मी, फी हफ्ता कम से कम 150 मिनट की इक़रार या 75 मिनट की भरपूर वर्जिश में मशगूल रहें। मशरूम बच्चों की बड़ी पैमाने पर सेहत और मजबूती को बरकरार रखने के लिए वज़न कम कीजिए। तंबाकू नोशी से परहेज़ करें। तंबाकू नोशी तक करना बहुत ज़रूरी है क्योंकि इससे भी कैंसर और तलीय मांस खतरा को कम करता है। नींद पूरी कीजिए। याददाश्त, जज़्बाती साज़ी और टीम सेहत की मदद के लिए रात को 7 से 8 घंटे की मेयादी नींद यकीनी बनाएं। सामाजिक रब्ता, ज़िंदगी को बेहतर बनाने के लिए मजबूत मसबत ताल्लुकात और सामाजिक जज़्बाती रफ़ीक मशहूरियत बरकरार रखें। वज़न का इंतज़ाम, दायमी बीमारी से बचने के लिए सेहतमंद बॉडी मास इंडेक्स (BMI) आमतौर पर 18 और 24 तक मॉनिटर रखें। शराब नोशी से परहेज़ करें। अल्कोहल के इस्तेमाल से परहेज़ करें। सेहत की जांच, मुंह सेहत की जांच कराने के लिए डॉक्टर के साथ बात करें। परहेज़ करने की आदतें, नींद की ज़िंदगी, तबीयत से गैर फालियत, दायमी तनाव, तनाव के साथ मुंह में ज़्यादा खाना, लिट्टी से बाहर खाना, अल्ट्रा प्रोसेस्ड फूड्स, ज़्यादा चीनी और ऐसे बख्शने वाला खाने से परहेज़ करें। सेहत का बीमा कराना डिजिटल टेक्नोलॉजी और हफ्ते में डिजिटल मॉडल का इस्तेमाल करें जो तभी से तलाश की करने और जिंदगी में मोबाइल तब्दीली के आसान चाहिए आपकी तैयारी करें बात बात करें कई बार जैसे इंजन की खासियत टेस्ट और हाई फंक्शन बाइक सिस्टम से सेहत का अंदाजा लगाएं इतना लाख बीमा की जानकारी के लिए एक फैक्ट है सारी बात है जिसे बनाना डिवाइस की तरह से रखा था जब आप बीमारी से सावधान रहना लंबी सेहत की खासियत जैसा है कि उसमें आपकी आवाज की जानकारी को बेहतर बनाना रोजाना वॉक करना टेक्नोलॉजी की मदद से चलने वाली तरीकों से तनाव को कम करने का इंतजाम करना समाज की बात बरकरार रखना
A long, healthy life is best achieved by adopting consistent, sustainable habits, eating a plant-rich diet, exercising regularly, 150 plus minutes per week, maintaining a healthy weight, avoiding smoking, avoiding alcohol, getting 7 plus hours of sleep, and nurturing strong social connections. These habits can potentially add over a decade to life expectancy. Key rules for longevity. Dietary habits. Consume a diet high in vegetables, fruits, whole grains, nuts, and healthy fats, like the Mediterranean diet, while minimizing processed foods, red meats, and sugary beverages. Physical activity. Engage in at least 150 minutes of moderate or 75 minutes of vigorous exercise per week, including strength training to maintain muscle mass. Avoid smoking. Smoking cessation is crucial, as avoiding it reduces risks of cancer and cardiovascular disease. Prioritize sleep. Ensure 7 to 8 hours of quality sleep nightly to aid in memory, emotional regulation, and cognitive health. Social connection. Maintain strong, positive relationships in social, emotional, or intellectual engagement to improve longevity. Weight management. Keep a healthy body mass index, generally between 18.5 and 24.9, to avoid chronic diseases. Limit alcohol. Consume alcohol in moderation, typically defined as up to 1 drink daily for women and 2 for men. Health screening. Regular checkups with a doctor for early detection of potential health issues. Habits to avoid. Sedentary lifestyle, prolonged inactivity, chronic stress, failing to manage stress levels, overeating, eating beyond satiety, ultra-processed foods, foods with high sugar and unhealthy fat content.
सेहत मंदाना डिवाइस की जाती है बत्तीस को देखिए कि बीमारी की जाती है लंबी सेहत से खासी जा सकती है ये उसमें आपको मार्केट में जाकर को करना रोजाना वॉक करना टेक्नोलॉजी की मदद से चलने वाली तरीकों से तनाव कम करने का इंतजाम करना समाज की बात करना उसके लिए खर्च करना है सेहत संभालने का इस्तेमाल है लंबी की दवाई है शनाख्त है चलने वाली बात है एक ज्यादा और मेटाबॉलिज्म है डिजिटल चलने वाला आम सबकी राइट है चलने वाला जैसे फूड वाइजर आपकी मेटाबॉलिज्म पैकेट और किसी चीज है साथ में यूज करते हैं सही दो है आपके साथ साथ और क्या काम खाने को तनाव को सही की किन सुबह खाने और प्रोसेस को संभालने दूसरे को खाने और आपके साथ आपकी बात की और सेहत की द फॉर समझ रोजाना खाना अच्छे से खाना 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 समाज की बात बरकरार रखना